Assalamu alaikum rahmatullah. You are seeing in these two pictures. Please observe this. What are you observing here? In this both picture, in this situation, there's a kid and doctor's nurse around her, around his, of this patient, and all are the smiling face. And this is another situation, intensive care unit, where the physician and patient both are smiling. Assalamu alaikum warahmatullah. I am Professor Shahj, Professor of Forensic Medicine and Toxicology, Ibrahim Medical College. Going to present doctor-patient relationship. This is one of the most important aspect of medical practice. It is so essential. Without building the trust, without building the relationship with the patient, no doctor can be a successful doctor. Objective of today's session: you will be able to describe the background rationale of doctor-patient relationship, introduction regarding concept of doctor-patient relationship, elements of doctor-patient relationship, skills for establishing and maintaining doctor-patient relationship, some models of doctor-patient relationship. We'll discuss these topics, and at the end of session, you will be able to understand this and describe this. First, let us see the background rationale of doctor-patient relationship. Doctor-patient relationship is the central part of health care. It is the central part of healthcare and practice of medicine. Doctor is in a superior position by virtue of his expertise and knowledge. Doctor is in a superior position, but patient is in a state of dispersion and dependency on the physician. Thirdly, patients feel fear, anxiety, and self-pity into the examination room, into the conversation with their physician. Doctor's responsibility is the doctor's responsibility to calm patients' fear and provide hope by the doctor's manner that is human. That manner will be compassionate. That manner will be empathetic and supportive. This bedside manner can alleviate the patient's fear and also installation of hope. Background rationale according to doctor's perspective. I have already told you, doctors in a superior position. That's why the responsibility belongs to the doctor mainly. Doctor's bedside manner or patient side manner is typically reassures. The term reassure and comfort the patient, while the competency of doctor, that is professional competency, remaining honest in diagnosis, management, and in maintaining trust. Also in maintaining trust. Vocal tones, body language, openness, presence, honesty, and concealment of attitude in some cases may all affect bedside manner. Suppose in your some behavior from some aspects of the patient raise your anger, but you have to conceal that attitude. Your vocal tone, your body language, your openness with the passion, your presence whenever the passion need, your honesty regarding your behavior, regarding your consultation, regarding your character, and concealment of attitude may all affect your bedside manner. Poor bedside manner, that is lack of this, even body language, vocal tone, all affect your attitude towards the patient, reflect your attitude towards patient. Poor bedside manner leaves the patient feeling unsatisfied, worried, frightened, and alone, and thereby disrupt the doctor-patient relationship. Thirdly, background rationale according to a patient's perspective. Patient want to be able to trust the competence of the doctor as well as efficacy of their caregivers. This is an on a study found this patient want to be able to trust the competence, the caregivers or the doctors or other, they have the required competence, and patient want to be able to trust their competence and efficacy of their caregivers. Secondly, patient want to be able to negotiate the healthcare system effectively. Patient want to be able to be treated with dignity and respect. Patient want to understand the way sickness and treatment will affect their lives. Patients often fear that their doctors are not telling them everything they want to know. These are the patient's expectation. Patients want to discuss the effect of their illness will have on their family, friend, or finances. Patient want to discuss this with the doctor. Patient worry about the future of him. Patient worry about and want to learn how to care for themselves away from the clinical setting. Patient also want physician to focus on their pain, physical discomfort, functional disabilities, etc. These are the expectation of the patient towards their caregiver or towards the physician. Now come to the concept of doctor-patient relationship. Doctor-patient relationship is a special kind of social relationship. Remember the term. This is a special kind of social relationship. Suppose lawyer and their client, there is a on type of relationship. There are also relationship with the parents and their children. There are also relationship with the customer and seller and buyer, etc. But doctor-patient relationship, this is a special kind of social relationship. This is a special kind of social relationship where bonding is planned and carried out with the final objective of helping the patient to achieve the treatment goal. In other way, you can say, you can define, or you can say, this is a doctor-patient relationship, this is a positive therapeutic relationship that encourages active participation of the patient in the treatment plan, contributing to success of treatment goals and minimizing malpractice suits. Now you can define doctor plan patient relationship in this way. This is a therapeutic, multi-layered, dynamic, and bilateral relationship that reflect wisdom and understanding that distill from generation to generation of doctor that demand respects, display compassion, sets the scene of trust and integrated human activity. All are integrated human activity. Prioritize both human values and morality. You can also define this. This is a special kind of social relationship where the bonding is planned and carried out with the final objective of helping the patient to achieve the treatment goal. Also, you can define in this way. Doctor-patient relationship has two components. One is instrumental, another is expressive. Instrumental component involves competence of the doctor in performing technical aspect of the care. That is performing diagnosis, taking proper history, physical examination, proper investigation, and ultimately perform the diagnosis. Then management, manage the patient and all aspects and risk, find out, treat them, prognosis, anticipate the prognosis, and maintain the health. These are the competence of doctor for technical aspect of care. Another expressive component reflects the art of medicine. This expressive component reflects the art of medicine, including affective portion of the interaction, altruism that is opposite to the egoism, empathy, unconditional love towards patience, tolerance, etc. And how to doctor approach the patient. Since Hippocratic days, patient has been asked to trust their physician without question. But recently, doctors been asked to trust their patient by conversing with them about medical options and soliciting their views on how to proceed. Previously, patient has been asked to trust their physician without any question. Now the days are changed. Norms is changed. Doctor is asked to soliciting the patient view to, to decide the medical options to proceed. Traditional conception of doctor-patient relationship, both Hippocratic Oath and the American Medical Association Code prior to 1960 are paternalistic. That is, here principles of beneficence and non-maleficence take priority over the principles of autonomy. We already know that there are four principles of bioethics. Among these, principles of beneficence and non-maleficence take priority over principles of autonomy. Here, the doctor is a quasi-parent, parent-like, quasi-parent. Doctor is benevolent, knows best, control exercise over patient in best interest of patient, is skilled and wise, authority not only in medicine but also in morality. On the other hand, patient is a quasi-child. Patient is dependent, incapable of understanding, incapable of making wise choice. And this paternalistic model was prevailing before 1960 of American Medical Association Code. And also Hippocratic Oath, it also defined this type of Doctor-patient relationship. Traditional conception of a doctor-patient is a paternalistic, that is Hippocratic and American Medical Association Code, Priority 1916. Now changing attitude towards the doctor-patient relationship. Alternative model. These are the engineering model, Peristly model, collegial model, contractual model, fiduciary model, consumerist model, etc. There are deliberative model, interpretative model, etc. And all have has special features. Now come to the aspects of doctor-patient relationship. Doctor aspects of the informed consent, shared decision making, physician superiority, physician bias, benefiting or pleasing, transitional care, turn taking or commercial dominance, presence of other person during examination, bedside manner, patient behavior, etc. These are some aspects of doctor-patient relationship, and you have to lot of research required within this. Now come to the elements of doctor-patient relationship. This is very much important, and it is also important for examination. Number one, trust and confidence. This is the foremost most important elements of doctor-patient relationship. As because without trust, no doctor-patient relationship can be stand. Installation second is the installation of hope and minimizing fear. This is also important element. Without this, trust and confidence cannot be developed. Dignity, respect, and empathy. Showing dignity, respect, and empathy in relation to the doctor-patient relationship also important, as because whenever there is a mistrust, this will again repair this trust. A personal relationship based on context of disease, illness, and treatment. Maintain the confidentiality. Informed consent. Patient's autonomy. Truth telling. Conflict of interest. Fairness and equity. Bridging cultural gap. Communication, and specific health issues. Specific health issues like corona treatment, like HIV, etc. In some situation, these are the elements of doctor-patient relationship. You should further study with these elements and lot of things. Some points I will discuss, but um, major portion you have to study further and thereby enrich your knowledge and understanding with this element. Trust is the essential to improve the personal and professional relationship. Even not only doctor-patient relationship, but also in personal relationship, trust is important. Perception of better trust, benefit of trust and confidence. If there is a trust and confidence, then perception of better care by the patient. Greater acceptance of the patient to the recommended treatment and adherence to that treatment if there is a trust and confidence. Trust and confidence a bit difference. Trust is a firm belief and confidence is assurance. Assurance without confidence is assurance without doubt, and trust is a firm belief. Law these if the benefits of trust and also in the doctor patient, if there is a trust and confidence, it lowers the anxiety to any treatment taken by the patient. facilitates the access to health service. Now come to the skills for effective doctor-patient relationship. These are the skills very much important. Self-development. Without self-development, whatever your bedside manner, doctor-patient relationship will not be continued, will not be maintained. That is why you have to update your professional skill. You have to build your professional skill and also update by continuous professional development or continuous medical education. Even after passing your examination, you have to self-develop by continuous professional development. And this is very much important. Also, skills of interpersonal relationship. Skills of interpersonal relationship. Skills of interpersonal relationship also important in your professional life, in your personal life, in your social life. Everywhere this skill is very much important. Communication skill, another skill is communication skill. To build the doctor-patient relationship, it has tremendous communication skill. You have to know about the expressive skill. You have to develop listening skill. You have to develop skill of overall management of communication. If you are a good communicator, you will be, you can make the doctor patient is a, in the best way. Mutual understanding and cooperation. Skill of mutual understanding and cooperation. Skills of patient psychology. Skills in patient psychology. Skills in ethical and legal expertise to save yourself and also to build ethically and legally. These skills, these skills, you further study regarding these skills and also make your understanding and knowledge better. It is also these skills is needed to make not only doctor-patient to build up doctor-patient relationship, but also in personal and professional life. Here we have already discussed this. Patient's right. Patient has the right to choose his own doctor freely. Patient has the right to access healthcare regarding of sex, age, religion, emergency service. Patient has the right to see the record and demand summary. Patient has the right to be treated with dignity, care, compassion, respect, without discrimination. Patient has the right to be treated privacy, to maintain the privacy and confidentiality. Get has the right to get information regarding investigation, diagnosis, treatment plan, alternative risk, right to know, refuse, or decision making record, continuity of treatment, comfort, and get compensation. With this background, also you have to remember this patient right in building the doctor-patient relationship and maintaining doctor-patient relationship. Also, you have to know that doctors are superior position and they are the in the vulnerable position. A starting point of doctor-patient relationship duty created where there is an intent or offer to treat or care, that is therapeutic intent. From that point, your doctor-patient relationship is the starting point. And ending doctor-patient relationship in two situations you can end the doctor-patient relationship. One is situation that may result in decision to end doctor-patient relationship. That is breakdown of trust and respect. Physician practice become too large to manage. Another condition situation where it is appropriate for a doctor to end doctor-patient relationship. These are the conditions here prohibited by legislation, prohibited by human right code, outline is the professional misconduct. Patients choose not to follow doctor's instruction. Patients require urgent service that is not available here. Model of doctor-patient relationship. Model, there are many model of doctor-patient relationship type according to level of participation. Situation where patient is unable to defend, as big as suppose such as emergency, medical or surgical condition, whereas he is unconscious or agitation or acute delirium. Direction of doctor and patient's cooperation. Suppose in acute infective disease, mutual and reciprocal participation of physician and patient. As example is a chronic case. These are the situations where the type according to level of participant, there are many doctor-patient relationship model. Types as a degree of customization अथवा or as a purpose of list. Here is the four. Shown four model. On is paternalistic model, on is informative model, on is interpretive model, on is deliberative model. In the paternalistic model, is a doctor, I decide for you. In informative, doctor give the facts for the patient. For patient's education, educate the patient. Here, interpretive model, doctor give some facts and help you to clarify your preference. Deliberative model, here doctor in addition to the information, also his preference, advice preference. Therefore, on his paternalistic model, doctor dominates interrogation. Patient is expected to comply without questioning. Doctor acts as a guardian, promotes patient health condition without patient's consent. This autocratic model of DPR is usually advocated in emergency situation, as obtaining consent from patient in such a situation might alter their medical condition. Secondly, informative model, that is consumer model. Doctor provide factual information about possible treatment options and patient choose from that. This is the patient-centered model. Interpretative model. Patient plays an advisor by explicitly interpreting the appropriate medical status of patient. The physician acquired the consent from patient, use the patient's decided intervention. Deliberative model, here also patient is convinced by the doctor. I have to skip this as because time is short. That's why. Among this model, I think fiduciary model is the best. Contractual model, paternalistic doctor is professional, knows best, benevolent, gives order, patient has to obey. Here the patient's autonomy is less. Contractual model, doctor patient contract for each other's mutual benefit. Patient agree to the doctor's decision. Model does not allow for trusting relationship. But fiduciary model is the best. Here patient confidently entrust his health care to doctor, who takes an obligation of working for the benefit of patient without necessarily sacrificing his own legitimate obligation. Here the mutual trust of both. This is the best model, I think. Usually emergency condition, the paternalistic model still is best. Be careful of this. Conflict of interest. Interest versus passion. If there is a conflict of interest versus passion versus society, interest of passion versus other passion, problems of confidentiality, patient belief and expectation, doctors consulting style, length of consultation, patient influence on consultation depends on social and educational level. Be careful of this. Now, in summary, we can say We discuss today about regarding introduction of doctor-patient relationship, some points regarding introduction of doctor-patient relationship. We also discuss the elements of doctor-patient relationship, the skills for effective doctor-patient relationship, and models of doctor-patient relationship. Take-home message: the good physician treats the disease. The great physician treats the patient who has the disease. Said by quote from William Osler. He was a renowned physician in the history of medicine. The good physician treats the disease. Good physician treats the disease. Great physician treats the patient who has the disease. With this word, remember this: physician-patient relationship is the keystone of health care. Trust is the keystone of physician-patient relationship. Today, I cannot give you the self assessment question here, but you have to thoroughly um, study regarding this and think about this. Um, you in the examination, doctor-patient relationship, definition of doctor-patient relationship, element of doctor-patient relationship, skills of effective doctor-patient relationship, models of doctor-patient relationship is important. And also, there are some, what are the condition where this doctor-patient relationship is break, it mistrust occur, and how to overcome this. With this few word, I am going to end here. Thank you all. Assalamu alaikum warahmatullah.